chances of getting pregnant greatly if you're choosing not to have sex or to wait, along with contracting an STI. You're also setting clear boundaries for yourself and your partner. And so a long-term benefit is you just have more control over your future goals and what that looks like, because these pesky things like STIs or an unplanned pregnancy aren't getting in the way, right? Getting regular testing for STDs and STIs is super important because early detection can be crucial for some of these, like HIV, detecting it early and getting on medication to get rid of it so that it's not turning into AIDS, which is then uncurable. So skipping ahead to some more negative choices and outcomes, if you are choosing to have unprotected sex, a short-term benefit would be you're going to have a higher risk of pregnancy, STIs, and stress, right? Because you're going to have sexual intercourse and you're going to be worried about these things. So it's going to cause some stress. The long-term benefits, outcomes, are going to be things like infertility, chronic infections, and lifelong HIV, which is AIDS. Or again, pregnancy, right? Skipping down here, incorrect birth control use. This is going to lead to pregnancy scares or possible pregnancy. So just because you're using these doesn't mean that that's the best choice. The best choice is to use them and make sure you're using them properly. So let's talk about the ripple effect real quick. How can our decisions affect ourselves, our family, and our community? So as you can see, the ripple effect, we make our decision and then we say how it affects ourselves, family, and community. So the example I wrote down for you guys is I decided to have unprotected sex. Now, how that affects myself is I could have a pregnancy scare. And like we just talked about, that could bring on some stress, some anxiety, possible STDs or STIs. Now, how would that affect my family? I would have to share with my family, or I would choose to share with my family, that I'm having a pregnancy scare, which means I think I might be pregnant, but I'm not sure. And this could create some family stress if your family is also not ready to support you having a baby at this time. And so how would that affect our community, or what is our community's role in this decision? We could see that there's more need for teen health resources in the community. Maybe there's no centers in the city or area that I live in that deal with teen pregnancy, no one I can go to for help, especially if my family isn't really on board with this and I need someone to talk to. There might not be anything in my community. So what I want you guys to do is pair up and think of a decision related to sexual health, something that we talked about today, and relate that to the ripple effect. So you're going to make your decision. How would it affect yourself? How would it affect your family? And then how would it affect your community? And I'm going to give you guys a couple minutes to talk about this, and then we'll come back together and share some ideas that you guys had. Fast forward. Now, the last thing that I want to talk about with you guys is how some of these health things can be controversial, or people just have really different opinions on them. And so it's really important that we're remembering that everyone has different opinions, and our opinions are shaped by our personal beliefs, values, and experiences. And so it's important to respect other people's opinions. And so some things that I gave you guys, some tools to use when you're having conversations on things like this. My first tool is I, not you. When you're talking, instead of saying you're wrong or you think this, just say I feel different because, and explain yourself, or I feel like. And this can take kind of like the blame mentality off of someone that you're talking to, and can make your conversation not seem like an attack on them if your opinions are different. The next one would be asking for explanation. So if something someone is saying doesn't really add up to you, just ask for more context. Say, can you give me an example of that? Or what makes you think that? Or what made you come to that conclusion? The last one would be listening to understand and not win. When you're having a conversation with someone and you're both giving your opinions, no one's technically right or wrong because they're opinions, right? And so try not to interrupt when someone is talking. And along with that, just asking more clarifying questions. So saying, so you're saying this, right? Making sure that you understand and you're not just waiting till they're done talking so that you can fire back. You're actually trying to see their side. And that wraps up our nice short lesson on sexuality today.